Hey, Kyle, thank you very much. The proposed change to Indiana's birth control access laws is stirring controversy tonight. Amendments added to a bill removes condoms and long-acting contraceptives from a new state program focusing instead on fertility awareness methods. News 8's Raina Revel breaks down what this could mean for reproductive health.
While supporters claim that this bill will improve education for low-income Hoosiers, critics worry it limits access to essential contraceptive options.
We have less unplanned pregnancies. That's a good thing. That's a very good thing. Two, we get our Medicaid rolls under control. And not only is that a compassionate thing, that's a fiscally sound thing to do. So it's a win-win.
Representative Jim Lucas is author of House Bill 1169. The bill aims to establish a taxpayer-funded access to birth control program for those earning up to 185% of the federal poverty level. This is to address what Representative Lucas calls an unsustainable trend of nearly half of Indiana births covered by Medicaid.
Since 2017, Medicaid has paid for, on average, 53% of the births in our state. There's only been 1 year out of the many that Medicaid did not pay for the majority of the births. Currently, we have 1.8 million Hoosiers out of 6.8 million Hoosiers. That's an unsustainable number.
Initially, the bill offered a wide range of contraceptive options, but recent changes took out condoms and IUDs or long-lasting contraceptives. Instead, it limited options to hormonal patches and self-administered drugs for Medicaid-eligible residents. Advocacy groups like Planned Parenthood argued this undermines comprehensive access and raises concerns about maternal mortality rates. The organization said in a statement, quote, "In a state where nearly 25% of counties are maternity care deserts and the third highest maternal mortality rate in the country, ensuring that all Hoosiers have access to information regarding all methods of birth control options is imperative."
I would tell people not worry just yet. We're not anywhere near the finish line. There is a process up here. There's the committee process. Getting a committee hearing, first and foremost, is the most important thing for any piece of legislation. Without that, you're dead in the water. Once you get a committee hearing, then the process starts.
Reporting in Indianapolis, I'm Raina Revel for Wish TV, wishtv.com, or follow us on Facebook for updates.
Mayor Joe Hogsett is instructing Indy DPW to adopt a 4-inch standard for plowing residential streets in Indianapolis for the remainder of what is the current snow season. The new plan is in response to the January snowfall. You recall, left some neighborhood streets covered for several weeks after the storm. People in some neighborhoods say their streets didn't get plowed at all. Mayor Hogsett says a fully new residential snow response will set out clear expectations for when and how neighborhood streets will be plowed. It'll be introduced during next year's budget process ahead of the winter season.
Speaking of the weather, let's talk about it here. Clear skies and sunny conditions after some early snow across the city this morning.